Welcome back, dear viewers. Heart rhythm disorders have become increasingly common worldwide, raising important questions about their causes, diagnosis, and modern treatment options. From everyday palpitations to serious conditions like atrial fibrillation, understanding arrhythmias is essential for early detection and effective management. This discussion explores the most common rhythm disorders, how they are diagnosed, and the latest advances in ablation therapy. Let's all welcome your guest and our guest in Good Morning Kuwait, Dr. Samah Alkharji, consultant cardiologist and cardiac electrophysiologist. So it's really a pleasure to have you. There are a lot of terminologies, medical terminology. It's really a pleasure to have you in Good Morning Kuwait.
Thank you for having me today, and good morning to everyone. And don't worry, we'll go over everything, so it will be easy for everyone.
Yes, we need a good explanation for each, a definition for each terminology.
Definitely.
Anyway, so Dr. Samah, you are a cardiologist, which means, for just regular viewers, you are a heart doctor. Okay. So what are the most common, let's say, heart rhythm disorders you see in practice today?
Yes. So heart rhythm disorders mean, our heart beats almost every day, continuously, every second of the day.
That's true.
And it cannot stop, right?
Absolutely.
So some patients or some people feel that their heart rhythm is not regular.
It's not like doop,
exactly.
doop, doop. It's like doop, 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 doop. Yeah.
Exactly. Or skipped beats, either too slow, too fast, or it's irregular. So these feelings sometimes can be a disease due to underlying disease, or as we were discussing earlier, it could be a manifestation of stress, excess caffeine intake, smoking, exercise. And as we know, our heartbeats go up and down depending on our emotional status and our mental well-being as well. So there are normal changes and there are disease underlying changes.
And how a patient or any human being can distinguish between a palpitation or a disorder?
So very good question. So when it's a problem that recurs every time, especially when you're not doing anything, if you're just sitting down having lunch or just relaxing and all of a sudden your heart beats really fast without you moving, that's definitely something not right.
Yeah.
And when sometimes associated with chest pain, sweating, dizziness, or even passing out, then these are alarming signs that should be checked out.
So, I just want to, go out of the questions. We play football. In football, there is like a random heart, beating or rhythm. So it's either doop, 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 like very fast when we sprint, and it's either like doop, 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 which is very slow when we are like, walking or, jogging very slowly. So this is good. This is helpful for, losing weight, stuff like that.
Yeah, so the heart's response to exercise is to increase, actually, so that's good. The issue comes especially when somebody just every once in a while plays football, so the body is not used to going really fast in some situations.
Okay, I see.
So that's why some people may not tolerate it. But if you're exercising regularly, but it's normally, it should go up and come down when you're cooling down during exercise. And that's healthy, and that's how it should be.
My question was, this is very healthy.
Yes. Variation
for somebody
is healthy.
If somebody wants to lose weight, it's better than regular heart beating.
I see. You mean, do we do more cardio, or do we target faster heart rate, or that's not good for the heart?
Yeah, something like cardio, for example.
Yeah, so cardio is definitely good. And also a common misconception, rarely or even never a doctor would tell a patient or any person to stop exercising. The heart likes to move, and it's good to train your heart like any other muscle. The heart is a muscle. So definitely increasing the heart rate every once in a while with exercise is useful.
So what are the symptoms that prompt any person to go right away to the emergency?
So that also combines the previous question, actually. So what are the common heart rhythm abnormalities, as we said before? So if somebody feels like there's a sudden onset or a sudden beat, that cause him to be short of breath all of a sudden, and it recurs over time. One normal beat
With
and then
dizziness.
exactly. Some people feel it in their throat, some people feel it in their ears, like there's an extra beat, or it's associated with a squeezing sensation in the chest that people sometimes might think they're having a heart attack. It's not something that happens once in a while, but if it's a frequent issue, then that should be checked out. Definitely a fast heart rate that when you're sitting down that doesn't stop and needs someone to go to the hospital to know what's the abnormality in the rhythm. And as we said, having fainting attacks, that should be checked out for sure.
So when we go back and take a nap, you know, most of the Kuwaiti, they take a nap. They like the nap. Okay. We are nap people.
After a heavy meal also.
Especially, exactly, after a meal. I mean, sometimes when you put your head on a pillow, your heartbeat, it beats, and you feel all of a sudden it's beating, you know, faster. Is this abnormality, or no, it's maybe because of some smoke or some heavy, you know, oily or heavy meal?
Yeah, so that's a good question also. So being aware of your heartbeat does not always mean there's something wrong.
It shakes you sometimes.
If it's normal rhythm, then it's not a problem. So being aware of the beating is not a problem. But if it's irregular or it's a recurrent issue, then that irregular or extra beat you're feeling that's associated with squeezing, then that's a different story. But being aware that you're hearing it more than usual.
You're hearing it, and it kind of shakes your body.
If it shakes your body, then we need to know what's causing the shaking.
Not shakes. I mean, not shaking as, you know, shivering. No, I'm shaking. The beat itself kind of moves.
Very strong, you mean. I see. So also that doesn't immediately indicate disease. But when the room is quiet, you're about to sleep, that's when most people feel that there's a problem in the heart.
So that's definitely. So how do you think arrhythmia are becoming more common in the Middle East and the Arab world?
So arrhythmias, so when we talk about arrhythmias, people don't know that there is a specialty dedicated to heart rhythm irregularities. So all cardiologists deal with these issues, but when it comes to disease and managing these diseases, they have to come to specialists. So why is it common? There are some less serious causes of palpitations. As we said, like extra beats or what we call PVCs. These are just extra beats that people feel, either with coffee or sometimes it needs intervention. On the other hand, there are issues related to all the diseases that are common in our society, like high blood pressure, a lot of heart attacks in our population, even at younger age, causing the heart to weaken. And when you have a weak heart, you are really predisposed to dangerous arrhythmias. That requires maybe more serious treatments, medications, or even devices. And on the other hand, also, because we have a lot of obesity, diabetes, and high blood pressure, we have a disease that is very common worldwide, but it's common in our area, but only recently awareness has increased to, about this disease, which is the atrial fibrillation that we will talk about. That can be silent in some patients.
Okay, what's atrial fibrillation? First of all, define what is this atrial fibrillation, and then tell us, doctor, what are the main underlying causes for atrial fibrillation?
So atrial fibrillation, or sometimes it's short with AFib, is a kind of an acronym for that.
Okay, let's call it AFib.
AFib. So AFib is a type of irregular heart rhythm. So you know the heart has 4 chambers or 4 rooms, the top parts and the lower parts. So AFib is a disease of the upper chambers of the heart. So these chambers, they should be synchronized, the upper with the lower. Exactly. So when the upper all of a sudden becomes irregular and beats very fast, the lower cannot keep up with it. So it will beat depending on what it can handle from the top part.
I see.
But when this is irregular, it's not squeezing all the blood to the lower parts. So sometimes the blood tends to stagnate in the atria, the upper parts of the heart, and causes issues that are associated with AFib, which are stroke, for example. So that's why in the management, we need to take blood thinners for these patients. So
this is not something, you know, you can play with. This is not,
exactly.
You know, this is really deep stuff. It's not.
It
Yeah,
is,
stroke.
sounds deep. It's very common, but some patients may not feel that they have it. They feel
Okay.
like they are fine, they're occasionally just short of breath, and they feel tired. In very few patients where they feel the heart is really fast, and these are the lucky ones because they'll go get checked
exactly,
out.
yeah.
Yeah, so it's very sad when it's missed and the first presentation is a stroke.
So how does AFib or atrial fibrillation increase the risk of stroke? Because, you know, you leave it and you are unknowing what's going on.
Exactly. So it's dangerous when people don't know, but when they know, it's that very irregular and it's fibrillating, so it's not squeezing. So when the blood, as we said, stagnates in these chambers, it forms small clots that can travel to the brain, to the arm, to the leg, and causes blockages in other arteries that can be a problem.
Where they're dangerous.
Exactly.
Do you consider AFib a modern lifestyle disease?
Unfortunately, yes.
Really?
Yes. So common associated or risk factors are obesity, and when people are obese, they're prone to hypertension, diabetes. Age is also a common...
Aging, yeah.
Exactly. But also we see it in younger patients these days,
That's true.
patients in their 30s and their 40s. These patients, sometimes the cause is unclear. So yes, if you have risk factors, you're at higher risk, but some do not have any risk factors.
Emotional and stress?
So emotional stress in general is not good for, so we're not talking about 1 or 2 episodes, but when you're under pressure for a very long time, that causes stress on your cardiovascular system, yes, for sure.
Yeah, definitely this is not something really to, you know, play with.
Yes.
Always check up, you know, and that's the beauty of checking up. So if somebody doesn't know what's going on and he had this AFib, but he doesn't know, but he goes regular checkup, he can detect that.
Yes, so it's easier than what we think, especially nowadays with the smartwatches. Some of them, they are designed and they were actually tested. It will tell you have AFib.
Oh, really?
Yes.
Oh.
So sometimes, yes, it's not accurate, but the fact that it detects something abnormal, it will push you to go check.
That's smart.
In a simple visit, the doctor can feel your pulse or can do the 12-lead EKG, which is the test where they put stickers on the heart and they take a picture of your electrical activity at that point. So that's one of the tests. And there are some other tests where you have to wear a monitor for several days for us to catch that abnormal heart rate.
In which cases, you know, do you recommend an implementable loop recorder instead of a short-term monitoring?
Yeah, so that's a good question. So now we monitor with several things. Either we do that ECG with the stickers during the clinic visit, we feel the pulse, or we use the patient's smartwatches as a kind of a tool.
As you mentioned.
Yes, and sometimes we put monitors external for as long as 5 to 7 days. If that all fails to diagnose it and the patient is feeling there's something abnormal, then we can put a device that's under the skin. And especially we use that for, unfortunately...
Is this what we call it, regulator?
No, so it's not the pacemaker. You're right. That's inside, goes inside the heart with wires. This one is just under the skin, but it will be in the chest. It's just a monitor, but lasts for years. It lasts for several years. Yes, it will not stimulate or do anything. It just records.
So that's what's called the implementable loop recorder.
Yes.
Amazing. So how have advanced mapping technologies improved early detection of subtle arrhythmias?
So this is dedicated, so we use what we call ablation. So what is ablation? For the management of several arrhythmias. When there are irregular heartbeats, sometimes we need to intervene when medications are not enough or when the disease is advanced that we need to go inside the heart muscle. And when we touch that muscle, we find the focus.
We try to poke it?
We poke it in other ways, but we kind of destroy the cells that are causing the abnormal heartbeats.
I see.
So mapping is a technology, it's a 3D technology, where it tells us where are the foci of this irregular heartbeat, and ablation is taking a wire, targeting those areas and destroying those cells.
So this is what we call it in Arabic, qastara?
قسطرة and K. If you hear K, Kuwait.
No.
It's the ablation part.
Ablation part.
Yes. قسطرة is anything that goes
yeah,
inside.
I
Yes.
see. Like
Yes.
coating.
Exactly, like
Okay.
cauterizing.
Okay.
But the technology these days is becoming really advanced, and we are lucky in Kuwait. We have the latest technologies from different energies. So you want to destroy the cells, we have radio frequency, or we use sometimes cooling or freezing the cells to destroy them.
Yeah.
Or the latest is pulse field
So
ablation.
as a cardiologist, Dr. Samah, because we are out of time, what's your last message? What would you like to say, any message to convey for our viewers?
If you're feeling anything abnormal, any irregular heartbeat, or if you're feeling you're tired more than usual, you're feeling short of breath, you have sometimes fainting episodes, go get checked out. And if you have a loved one who's more than 65 years of age, make sure they get checked with an EKG at least once a year during their checkup visits.
Is coffee good for our health?
Yes, coffee in moderation is good.
In moderation. So, you know,
enjoy
it's
your
good.
coffees.
Enjoy your coffees.
Yes.
Anyway, thank you very much, Dr. Samah.
Pleasure is mine. Thank you.
Alkharji, great thanks to Dr. Samah Alkharji, consultant cardiologist and cardiac electrophysiologist. Dear viewers, stay tuned. Please don't go away. We'll be back after this break.